Good evening, everyone. Welcome to One Shot series. Today's topic of discussion is autopsy. Yes, guys, I'm audible. I'm audible and visible. Autopsy. What is autopsy? Autopsy means postmortem examination. It is also known as thanatopsy. Thanatos is the Greek god of death. Thanatology is the study of death in detail. Thanatopsy is nothing but autopsy or postmortem examination, also known as necropsy also. Okay, good afternoon. Yeah. Good afternoon, medico, duty. Yes, good evening all. See, autopsy, there are many types. Okay. So, autopsy, there are many types. Like example, pathological autopsy. Pathological autopsy is also known as clinical autopsy. Medico-legal autopsy. That is basically forensic autopsy in case of unnatural death as per 194 and 196 BNSS. It can be psychological autopsy. Psychological autopsy means the questionnaire to find out the mental status of the person. Like example, history of depression in case of suicide. Okay. Then it can be virtual autopsy. When autopsy is done with the help of MRI, CT scan, with the advanced method, that is known as virtual autopsy or digital autopsy. Something known as negative autopsy. When the findings are negative, no positive findings, even after complete postmortem examination, toxicological analysis, and histopathological analysis, that is known as negative autopsy. There are many causes. Or when there are some findings are there, some minimal findings are there, then that is known as obscure autopsy. Okay. So there are basically 6 types. Pathological, that is clinical autopsy. Medico-legal, that is forensic autopsy. Psychological, that is the questionnaire in case of suicidal death. Virtual autopsy, that is digital autopsy. Negative autopsy, when all the findings are negative, no positive findings at all. And here MCQ point you need to understand. Medico-legal autopsy, consent is not required. Consent matlab permission. The permission is not needed in medico-legal autopsy from the relatives. But in clinical autopsy, the permission or the consent is needed from the relatives. So, as per 194 and 196 BNSS. Okay? Yes. Chal. Then comes is one very important topic, types of skin incision during autopsy. Very commonly asked in exam. Can anyone identify what is this skin incision commonly done during postmortem examination, which starts with the chin, ends at the pubic symphysis, sparing the umbilicus? What is this incision? Medico? Duty? Can you answer? We'll talk about skin incision. So there are different types of incision. I incision, Y incision, modified Y, X-shaped incision, fourth incision or cosmetic incision, T-shaped incision. What is this incision? So this is one common incision known as eye-shaped incision. Eye. याद रखना, it starts with the chin up to pubic symphysis. It is the most common incision. Most common. Very good, Duty. Good answer. And the second type you can notice here, which starts with the acromion, go under the breast and to the pubic symphysis, which is basically cosmetic incision done usually in female examination of female dead body, postmortem examination. So this is known as modified Y. Which is done in females. Okay, good. Then we can notice one more type of skin incision you can make out here, which is commonly done in case of hanging and strangulation, which extends with the master process, then to the midpoint of clavicle, from the midpoint of clavicle into the sternal notch. You can make out here. And from the sternal notch, that is into the pubic symphysis. This is known as Y-shaped incision. Y. Where it is done? It is done in case of hanging and strangulation. Any case of neck injury, so the incision done, that is basically Y. Okay, this is very commonly asked. And in case of hanging and strangulation, the neck is opened at last. So once you open neck, soon after opening all the cavities, the area is avascular. Once it is avascular, you can see clearly the injuries. That's why neck is opened at last in case of Y-shaped incision. This is also known as bloodless dissection of neck. Yaad rakhna, the cause of death in case of hanging is asphyxia, strangulation also asphyxia. Sometimes it can be venous congestion. Hanging can be typical hanging, atypical hanging, complete hanging, partial hanging. That we are going to discuss in asphyxial death. Okay, that's fine. Then we can make out here one more type of incision. Can you make out here? Incision on the back, that is extending from acromion above the scapula and to the midline and to the iliac crest. What is this incision known as? Can anyone answer? Vaishnavi, Dhruti, medico-legal, which is normally done in case of custodial death or whenever there is a history of spinal cord injury. This incision is made. This is known as X-shaped incision. In case of spinal cord injury, lock-up death. Good, good. Then we have one more we can make out here in the same slide. So this is T-shaped incision. So basically to look for vertebral artery and other arteries. So this is T-shaped incision. And one more, inverted Y incision. This is inverted Y, especially in case of infant death. So this is inverted Y. Okay, which is to determine the level of diaphragm, to differentiate between the stillbirth and live birth. We use an incision that is known as inverted Y. So 1, 2, 3, 4, 5, 6. So there are basically 6 types of incision. The most common incision, that is eye-shaped incision. So is it clear, guys? Yes, say yes or no. Very important 3 marks question. Very commonly asked in INICET exam and even NEET PG exam. Is it clear? Say yes or no. Yes, Duty, Vaishnavi. Okay, that's great. Then one extra point, the new type of incision that is invented in India. You can see here the new type of incision, that is anterior plaf and the posterior plaf. This is known as patovary incision. Okay, patovary. Patovary matlab cosmetic incision, also known as fourth incision. In this incision, the skin is dissected in two flaps. One is anterior flap, anterior and posterior. We can make out here. So this is the anterior flap. Anterior skin is removed, and the same way on the posterior side. So whenever question asked anterior posterior flap, your answer must be patovary incision or fourth incision. Okay? Yes. So this is commonly asked in the exam. So all of you just type patovary in chat box. Patovary. The students, write patovary, so that you can make the class interactive. You can keep me awake. You can keep yourself awake. Patovary. Chalo. So this is about the skin incision. Yeah, great. Now the comes as the postmortem evisceration techniques. Evisceration, that means the removal of organs. Like organs can be removed one by one. Organs can be removed in an organ block. Organs can be removed in, en masse technique or in situ dissection. So depending upon the removal of organs, it is classified into four types. So one is Letulle, Virchow, Ghon and Rokitansky. Let's start one by one. Letulle. See, the best technique, Letulle technique. The best technique and the most difficult technique, that is Letulle. In Letulle, there is an en masse dissection. En masse. All the organs are removed at a stretch. See, from tongue to the prostate, all the organs removed at a stretch. That is classically known as Letulle technique. One of the best technique. Okay? Letulle. Then you can do the organ dissection outside. The second technique, Virchow technique, one of the most common technique and very easy technique. In Virchow, individual organs are removed. Like example, brain is removed and dissected. Neck structures are removed and dissected. Hyoid bone is dissected. Or stomach is removed, dissected. Spleen, kidney, liver, blood vessels. Most of the organs are removed one by one. That is known as Virchow technique. Individual organ technique. So all of you write Virchow is equal to, in chat box you write 1 by 1. ये क्या है बताओ? 1 by 1 technique है. Remove organ separately. ठीक है? This is Virchow. Third technique, Ghon technique. Ghon याद रखना, organs are removed in blocks, like 3 blocks, like cervicothoracic 1 block, abdominal 2nd block, pelvic 1 block. When organs are removed in blocks, that is known as Ghon technique. So Ghon separate blocks dissection, organ separation. So there are 3 blocks. What are they? सर्वाइकोथोरैसिक, एक है सर्वाइकोथोरैसिक, दूसरा है abdominal है, तीसरा क्या है? Pelvic. This is Ghon or Ghon technique, that is block technique. Then the last one, Rokitansky. Say example, dead body is infected, HIV positive, hepatitis B positive, or COVID-19 positive. In that case, there is a high risk of transmission of disease. In that case, organs are dissected in situ, मतलब within the cavity. इसको बोलते हैं हम Rokitansky technique. So it is done in case of HIV, hepatitis B, and COVID-19. ठीक है? Very important topic, concentrate. Can be a 3 marks question. Evisceration technique, there are 4 types. Most common, Letulle. The best, Virchow. In situ dissection, that is Rokitansky. Ghon technique, organ block. There are 3 blocks: cervicothoracic, abdominal, and pelvic block. So is it clear? Vaishnavi? Very commonly asked. So yes or no? Duty and others. This is second topic. Third topic, routine preservation of viscera. Routine preservation of viscera. See, viscera is preserved in case of poisoning. Like example, OP poisoning, organophosphorus poisoning, aconite poisoning, heavy metal poisoning. So, what are the viscera they are preserved? So, that is very commonly asked. And one more thing, what are the preservative? Yes, one by one, let's discuss. Routine preservation, stomach and stomach content. Again, there is an MCQ here. For example, this is stomach. So, stomach is preserved in a separate bottle, 1 liter bottle, glass bottle. The stomach is opened at greater curvature. Greater curvature. Stomach is preserved, stomach contents. Second, upper part of small intestine, that is basically duodenum and contents. Liver along with the gallbladder, around 500 gram. Liver is the largest organ, that is preserved. Half of each kidney, right and left kidney. Okay? And in some cases, that is, most of the cases we preserve blood also. Blood around 30 ml from the femoral vein. Femoral vein preferred. Urine around 30 ml. The preservative is thymol. In some cases, like example, cyanide poison, spleen is also preserved. So, all is a routine viscera in case of poisoning. Okay. One very famous case is, curry and cyanide case. In, curry cyanide case is a very famous case where the 5 peoples were killed by mixing cyanide with the curry. In that curry cyanide case, the father-in-law was killed, mother-in-law was killed, and a small 1 or 2 kids, as well as the husband, by mixing cyanide with the curry. The motive was basically, that is, property motive. In any suspected case of poisoning, you need to preserve all these viscera. Okay, like this. You can see here one more picture. The bottle number 1, stomach and intestine. The bottle number 2, liver, kidney, spleen. The bottle number 3, blood. Bottle number 4, urine. Bottle 5, preservative. So this is how we are going to preserve the samples in case of poisoning. Okay. No, it is not cryopreservation. So this is basically normal saline is used. So what are the preservative? So most common preservative is saturated solution of common salt, because it's very cheap and very effective. Okay, so that is one. But the best is rectified spirit. Rectified spirit. This is very commonly asked. Now here some more important question. What are the conditions in which brain is preserved? Can anyone answer? कहाँ करते हैं बताओ? Brain. So normally we preserve these organs only, but in some cases, some special cases, we preserve brain. Can you name one condition where brain is preserved? Aditya and others? Brain is preserved in. Definitely CNS poison. Can you name some CNS poison? Brain, very commonly asked. Bone is preserved in. Especially femur is preserved. Bone. CSF. Heart. Very commonly asked. And spinal cord. Okay. Try. Can anyone answer? Brain? Brain duty is telling which poison? Can you name some CNS poison? There are many CNS poison. Can you name one CNS poison? So, brain in case of opium poison, OP poison, alcohol poison, barbiturates, benzodiazepines. Very important topic. Bone. Bone in case of heavy metal. याद रखना पड़ेगा. Heavy metal. Like arsenic poison. Arsenic is known as king of all poison. One of the ideal homicidal agent. In arsenic poison, lead poison, heavy metal poison, preserve bone. CSF. CSF usually in case of alcohol poison. Alcohol. So one of the CNS depressant. It is associated with many crime. Like example, party drug, rape, accidents, assault, murder. CSF, alcohol estimation. Heart. Can anyone tell me heart is preserved in? Anyone guys? Heart. Heart. 250 gram, 300 gram. Heart is preserved in. Your answer should be cardiac poison. One cardiac poison is aconite. Oleander poison. Digitalis poison. Foxglove. Nicotine poison. Heart is preserved. Okay? Very good. Nicotine. Vaishnavi. Spinal cord. Can I answer spinal cord? Spinal cord is normally not dissected, normally not preserved. In certain cases, we do preserve spinal cord. What is that condition? Yes. Spinal cord, strychnine poison. Strychnine or gelsemium poison. Gelsemium. Okay? All these are very commonly asked questions. Yes, Aditya. Good. That's great. Now some more important questions. What are the contraindications of common salt? What are the contraindications for rectified spirit? Very commonly asked. Let's see some more. Saturated solution of common salt is contraindicated in pneumonic is AC. A मतलब alkali and corrosive. Aconite poison, corrosive sublimate. In all these conditions, saturated solution of common salt is contraindicated. The best preservative, I said already, rectified spirit. For virological examination, we use 50% sterile glycerin. Like example, rabies. Rabies transmitted by warm-blooded animal bite. Like example, dog bite. Characterized by hydrophobia. ठीक है? Okay, Aditya. Hydrophobia, aerophobia, photophobia and all. In that condition, we preserve sample in, that is 50% sterile glycerin. Basically to look for negre bodies. Negre bodies are commonly seen in rabies. Then rectified spirit is contraindicated. Usually in case of alcohol poison. Kerosene, kerosene causes chemical pneumonitis. That is a contraindication for rectified spirit. Chloral hydrate, my favorite. Dry wine, that is basically a contraindication for rectified spirit. Formaldehyde, that is formalin. Paraldehyde, phenol, phosphorus. In all these conditions, rectified spirit is not used. We use basically common salt. Very important question. याद रखना, phosphorus can be of two types. Yellow phosphorus, red phosphorus. Can anyone tell me which is poisonous? Is it yellow phosphorus or red phosphorus? Try. Duty. Which is poisonous? Yellow or red? Yellow is also known as white phosphorus. Red, because of red color. Red phosphorus is non-poisonous. That is used in the preparation of matchstick and the side of the matchbox. Okay? Yes, Swastik said, why kerosene causes chemical pneumonitis? See, kerosene when it is taken orally, nothing will happen into the GI tract. But when it is aspirated, it causes inflammation of the lung. That is known as chemical pneumonitis. The chemical pneumonitis caused by the kerosene has very serious mortality. That's why. Yellow, very good, Swastik, good answer. Then sodium fluoride. Basically for blood, vitreous, alcohol, cocaine, carbon monoxide and cyanide. Remember sodium fluoride, it inhibits an enzyme known as anolase. आपको पता होगा, anolase is a very important enzyme of glycolysis. This enzyme inhibited by sodium fluoride, for estimation of blood glucose level, we use this sodium fluoride. And याद रखना, alcohol, cocaine, yes, cocaine, cyanide. Cyanide is an ideal, suicidal agent, ideal homicidal agent. There are many cases we discussed in Booth Bungalow series and all. So all these are basically one-liners. So this about some important topics in autopsy. Now let's have a discussion of 10 important MCQ along with the interaction. So are you ready, guys? INICET NEET PG questions. Ready? Say yes. We are going to start now MCQs. MCQs, most important MCQs in autopsy. Recent questions. Say yes or no. Come on guys, I'm waiting. So what we discussed today, types of skin incision, we discussed many types of evisceration, what are the organs preserved in case of poisoning, and what are the preservative and contraindication. So, and types of autopsy, right. So first question, methodology in Virchow technique. आया था, एक बार आया था एग्जाम में. Organs are removed en masse. Whenever word en masse, Letulle होता है. क्या है? Letulle नहीं. Organs removed one by one. So this is basically Virchow है. In situ Rokitansky है. organs removed and block, that is Ghon technique है. आंसर क्या है बताओ? आंसर है बी इज द आंसर. बी. यस. वैष्णवी वेरी गुड. आदित्य वेरी गुड. आनंद एक्सलेंट. गुड. ग्रेट. स्वाति ग्रेट. चलो सेकंड क्वेश्चन. Brain, brain weight is 1200. You can see here brain here. You can see the meningitis there. You can see the pulse there. Brain is preserved in all the following except लिखा है. क्या लिखा है? Except लिखा है. Option A, OP poison, alkaloid, heavy metal, volatile organic poisons. बताओ जल्दी बताओ. Brain is preserved in OP सही है. Alkaloid सही है. Heavy metal, no. Heavy metal cannot cross blood-brain barrier. So the answer is C is the answer. Volatile organic poison, yes. The answer is C. In arsenic poison, heavy metal poison, we preserve bone, not the brain, guys. Okay? Good. C is the answer. That's great. So, and here one more MCQ, guys. I'll have to write in the chat box. King of all poison. King. Arsenic है. Queen कौन है बताओ? Queen है aconite. लिखना. Chat box में लिखना. King is equal to arsenic. Queen is equal to aconite. Just write so that some interesting fact in forensic medicine. ठीक है? Arsenic is heavy metal. So, measline, raindrop pigmentation, red velvety stomach, king of all poison, 100 to 200 mg is the fatal dosage. It mimics like cholera. Okay? The drug of choice is ball. Frequently asked. I'll have to write this word. King is equal to arsenic. Queen is equal to aconite. Great, Vaishnavi. Good. Next question. Question number 3. Ideal time to start exhumation. So, exhumation means digging out the dead body from the grave. You can see here. You can see the forensic experts. They are removing dead body. You can make out the skeleton here. Removing of dead body from the grave for second autopsy. In case of homicide, in case of murder, in case of some unnatural death. Exhumation है. Ideal time कौन सा है बताओ? Option A है midnight. यार, who will go to exhumation at midnight? Nobody will go. Midnight नहीं है. Late evening? No. You see, exhumation, I have conducted more than 10 exhumation. In my experience, exhumation takes around 10 to 12 hours. If you start in late evening, it will become midnight. Both आ जाएंगे, है ना? Answer is early morning. Answer is D. याद रखना, exhumation, no time limit. Exhumation in India can be conducted after 10 years, 20 years, 30 years, 40 years. But different countries have different limit. But in India, no limit. And one more thing, exhumation is done with the help of magistrate inquest. याद रखना, magistrate inquest. And it is 196 BNSS. In exhumation, you need to preserve the soil sample also. Around 6 soil sample. So, from all the sites and to remote sample to rule out any heavy metal poison. Soil from the 6 sites. Good duty. Great. ठीक है? हो गया. Then very interesting question. Postmortem examination is also known as necropsy, thanatopsy, autopsy, all the above. What is the best answer? D answer है. Easy है. Autopsy should be conducted in daytime because bruise, laceration, some color, it's better interpreted in daytime, daylight. So answer is D, and I discussed in detail about it in the beginning. Now this is very interesting question. इसमें क्या है? All are true about medico-legal autopsy except लिखा है, except all registered medical practitioner in government service can conduct exhumation or examination. Yes, that is true. Even doctors working in private college affiliated to state government, they can conduct autopsy. That is true. No unauthorized person should be present at the autopsy. True. Don't allow any person other than the police officer, other than your staff. True. Autopsy should be conducted in daylight. True. Consent from relative is needed prior to autopsy. False. Consent matlab permission. In medico-legal autopsy, there is no need of permission from relatives. Usually, they will not give any permission in any forensic autopsy. Once the person dies as a result of unnatural death, the case becomes the accused versus the state. So, it's a property of state government. The investigation is part of the part of the state inquiry. Answer is D. Yes, who answered? Yes, many answered. Basically, Duty answered, Vaishnavi answered, Anand also answered, Aditya also. Panchanama needed. Yeah, good, that's great. Chalo, 5 ho gaya. 6th one. Now look at this. This is a very, very interesting question. Which body cavity should be opened in case of air embolism? Air embolism matlab air in the blood vessel. Definitely very dangerous. Like air in the blood vessels of the brain, that is known as brain air embolism. In the heart also it is dangerous. Which body cavity is opened? Head, chest, abdomen, any cavity? Yes, come on, try. The answer is head. Head. Why? Because air embolism is better visible once you start examination with the brain. You can make out here. So this is brain. You can see the brain there. We can make out this is the air embolism. Can you see the bubble here? This is air embolism in the brain. Okay? Air embolism can lead to death. Fat embolism, air embolism, amniotic fluid embolism can lead to death. Can you make out the air here? Blood vessel? You can see the blood vessel here. In between, can you see the gap there? Can you make out? Okay? Can you make out, guys? Duty? This is the picture, very nice picture showing air embolism. In pneumothorax, thoracic cavity is opened first. MCQ. In case of infant death, the abdomen is opened first to know the level of diaphragm to roll out from stillbirth to that is live birth. Okay? Yes, you can make out. This is a very, very interesting question. Rectified spirit is not used as preservative in case of. Very good question. See, rectified spirit nothing but alcohol, ethyl alcohol. Definitely it is not used in alcohol poison. That is phenol poison. So answer is A. Cyanide, no. Insecticide, no. Alphos, no. So alphos basically aluminum phosphate poison. Again, one more MCQ. Aluminum phosphide poison, that is alphos. Insecticide, basically OP poison, which inhibits acetylcholine esterase. Again, there are two types of acetylcholine esterase, that is true choline esterase and pseudocholinesterase. Yes. Answer is A is the correct answer. Ideal incision used for autopsy in case of custodial death. Basically the spinal cord injury. Why cosmetic incision, eye-shaped incision, modified why? It's a good question. Anand and others, can you try? Y-shaped incision in case of hanging or in case of strangulation. I-shaped incision most common incision है. Modified Y in case of females. So what is the best answer then? The best answer is Anand, very good answer. So answer is B. It is also known as Patovery incision, anterior posterior pla. Okay, answer is B. Vaishnavi, very good. Then for histopathological examination, tissues are preserved in. Very good question. See, for histopathology, formalin is used. For visceral analysis, saturated solution of sodium chloride. Blood, sodium fluoride along with the preservative. Urine, that is thymol. Histopathology, answer is 10% formalin. A is the answer. Okay? Not the rectified spirit, not sodium chloride, not absolute alcohol. Yes, okay. And the last question. The flame-shaped subendocardial hemorrhages. For example, this is the heart, flame-shaped. So when you see like this flame-shaped, so they are known as, so this is right ventricle and left ventricle. So these are known as Sheehan hemorrhages. Sheehan's. Durate hemorrhages seen in brain in case of brainstem injury. Simon hemorrhages in spinal cord. Fault off in lung in case of drowning. I think nobody has answered. So B is the answer. Okay? B. Chalo. Now let's see some images. Look at this. So this is brainstem. As you know, brainstem is midbrain, pons and medulla. When there is a brainstem trauma, brainstem injury is there, herniation is there, you will see durate hemorrhages. So these are all durate hemorrhages. Clear? Can you make out? This is durate hemorrhage. Look at this image. So this is basically spinal cord. And in the spinal cord, we can make out hemorrhage there. इसको बोलते हैं Simon hemorrhage. Simon hemorrhage. Again, non-specific finding in case of hanging. It can be seen in road traffic accident, railway accident. Simon hemorrhage. One more image. Look at this. This is a case of drowning. And in drowning, you can make out here, there are some hemorrhages are there. These hemorrhages are very common in the lower lobe. And these are known as Pultoff hemorrhage. Okay, Pultoff hemorrhage in case of drowning. Then, and the last image. In this image, you can make out this is the, caudate tendinae of the heart, left and right ventricle. You can make out flame-shaped hemorrhages. Can you identify what are these hemorrhages, guys? Now, can you make out Dyuti, Anand, Future, Vaishnavi? ये क्या है बताओ? Flame-shaped hemorrhages seen over the left ventricle, right ventricle in many conditions. Okay. This is known as Sheehan hemorrhage. Sheehan's hemorrhage. So we discussed 4 images. We can make out once again here. So this is Durette hemorrhage, Simon hemorrhage, Pultoff hemorrhage, and Sheehan hemorrhage. Is it clear, guys? Say yes or no. Can you make out? So this completes a short session around 30 to 45 minutes covering most expected questions, most important questions from autopsy. I hope you understood. So thank you all. We'll come up with some more important topics, some more important clinical scenario in upcoming classes. Thank you all.